Hey guys, welcome to episode 2. Today we're going to be focusing on ankle mobility. This will be something great to incorporate before your squat sessions because that'll allow us to really get into those deep squats and really use that to our advantage. So we're going to start with looking at a little bit of an assessment technique which will allow us to identify what is limiting our ankle mobility. Alrighty guys, like we were just saying, we're going to start with an assessment to identify what is limiting our ankle mobility. So there's two main areas that can prevent it. At the front of our ankle, we can get that tight pinching, which is that actual joint preventing it. Or a second assessment, and we identify that the limitation might be at the back during our calf, that tightness, okay? So how we assess this is called a knee to wall, okay? So all you need is a wall. So start with your toes maybe 5 centimeters back. From this position, it's important that we maintain a flat foot with the ground. What we want to do is then drop that knee and try to get it to touch the wall, okay? So in this position, you might feel that pinching at the front, or might be the tightness at the back, and from there you can identify what is limiting your ankle mobility.
Alrighty, so as Alex just did in the assessment, if you are feeling that pinch at the front of the ankle, that's going to indicate a restriction. So we're going to want to address this first before moving on to any soft tissue or stretching work. So usually in the gym we would use bands to do some distraction techniques to distract that joint and allow a bit more range of motion. Because you guys are at home, it's a little bit harder without bands, but there is one self-mobilization technique you can use. And this was done by Dr. Ryan DeBell from the Movement Fix. So what you're going to do is feel for those bony protuberances on either side of your ankle, and you're going to situate your fingers just underneath them. And we're going to be pulling our foot this way, while with the muscles of our leg, pulling our leg this way. So what this is going to do is just open up that joint capsule, and then in this position, when we pull away, what we're going to do is just move our foot in and out of plantar and dorsiflexion. So you might feel some crunching, and we're just distracting this joint to allow a greater range of motion. So we'll go for about 10 reps in plantar flexion and 10 reps in dorsiflexion for about 2 sets. Alrighty, so now that we've done the distraction for the joint, we're just going to work on a little bit of soft tissue work before we go into the stretching. So this you're just going to need like a foam roller. If you don't have a foam roller, then you can just find anything hard at home that you can rest your calf on. So we're going to have the calf that we're working on the foam roller, and then the other leg over the top, just to apply a bit more force down into the roller. And then we're going to situate that at the bottom of our calf, up with our bottom off the floor, and we're just going to be rotating in little circles on that roller. So we'll go 5 in one direction, and then 5 in the other direction. And then what we're going to do is roll onto our medial calf. So we should be at about a 45-degree angle with that foot. And we're going to do the exact same thing. So rolling one way, rolling the other. And then finally we're going to roll the other direction. So calf on the outside. And then same thing, doing those little circles and back. So if you do have a roller, we're also just going to slowly roll through the calf. So ever so slowly roll through the calf, trying to release that tightness, and back, and same thing through the inside of your calf, and then the outside. So if you don't have a foam roller, just do the rotations, and then we'll move on to some stretching from here.
Alrighty guys, so the next exercise we're going to be looking at is looking at a bit of that soft tissue work and try to increase the range through that back of the calf, if that was identified on our assessment or after we've just done the previous exercise, okay? So for this next one, all we need is a stool or a kind of sort of chair where you can grab around the side and really use that force of your body and your hands to increase that range, okay? So just an example, so putting our foot up that we're trying to stretch, hands down by the side, and then using your body weight and your chest, really push down towards the ground, and then you want that knee over that toe, getting that nice stretch at the back of our calf. Hold, and then you can release it off, and then coming back in, looking for a bit further stretch this next time, okay? Really pull it in, getting that nice soft tissue stretch out the back of the calf, and then bringing it back up. Again, doing 6 reps with about 5 seconds hold, doing that 2 sets of that would be fantastic.
Alright, so this next one is going to be a bit of a progression from the last one. So it's going to be a similar movement, but we're going to be exercising that ankle through a couple of different angles in its range of motion. So it's going to be using a stick. Again, just use a broom or a mop or anything like that. A couple of inches away from your toes. And we're going to be bringing that knee firstly straight on to the stick. And then we're going to be going to the outside of the stick, back, and then to the inside of the stick. So just keep going through this. Trying to keep that heel nice and flat on the floor and holding for a couple of seconds in each one. So here we're going to go for about 6 in each position and do that on both legs.
Great guys, so final exercise, we're going to get into a deep squat position, okay? Still focusing on that ankle mobility, use of our elbows. What we're going to do is try to keep that foot flat on the ground, really drive that elbow, pushing those knees over those toes, rocking from side to side. You can see I'm getting a nice stretch throughout the joint and throughout the soft tissue at the back there. So rocking from side to side. There we go. A good progression from this, guys, is use of a weight. The weight you can use for that extra force to really push through that stretch from side to side and holding it out in front, going from side to side on those ankles.
Alrighty, so that's all from us today, guys. So thank you again for watching. Idea here is just to take a few exercises from each one to put together your own little routine. So stay tuned next week for shoulders and hips.